Hello, good evening, Adriani and Pilar. How are you? Thank you.
Good, thank you.
Hello, thank you for coming tonight.
Hello.
Hi, Lau.
Thank you too.
Hello, Pilar. Nice to meet you.
Nice to meet you too.
I like when you guys turn on the camera because it's a little weird to talk to a black screen. Yes, thank you. But for now, hi, Lau. Ella siempre me prende la cámara. Hello. On Saturdays is a little different because we don't really interact so much as in the class, right? So most of the time I will be reading the article. But anyways, thank you guys. In Tamara, todas mujeres, ¿no? ¿Dónde estamos? So tonight.
What's your name?
My name? Oh, because yes, I'm sorry. I know sometimes it's people who don't know me. I'm Dr. Andrade or Michelle.
Yeah.
Call me Dr. Andrade. And I'm in Ecuador. I don't know, maybe are you a doctor or student? Pilar?
A student.
Oh, okay. Of medicine. Medicine?
No, I mean, I'm professional now, but I am in my country. Now I'm living in Tampa, so I'm in the States, and I'm trying to homologate my professional career here. So for that reason, I just want to get this course.
Hello. I'm sorry. Se me fue trabaron los idiomas. Acá me saludaron. You see, my camera is not working well, so sometimes I turn it off.
Yeah, it's blinking. Yeah.
Yeah, I know. Se me pone como que estoy en un rave. A veces vamos a apagarla para que no se me mareen. Oh, that's very good, Pilar, that you are doing that. I actually did the same thing. So if you have any question, you can just let me know. I worked in New York. So are you a general doctor?
No, I'm like a clinical lab technologist.
Ah, okay. So you
in my country, the name is bacterióloga.
Pero es de medicina. ¿Bacterias es una subespecialidad o estudiaste aparte?
No, yo no soy médico. Así es nuestra carrera, se llama bacteriología y laboratorista clínico.
Ah, okay. And you have to take some tests also for that.
Yeah. We help doctors to make diagnosis.
Yeah. I know. But no, I'm saying the test, you have to take also tests for that. Well, I was talking about the USMLEs that are for doctors. So in that part, I really don't know, but it's good. So then obviously you need to know the medical terminology.
Yeah.
Okay. So right now we will start with the name is International, well, the journal, it was published on the International Journal of Surgery Case Report, and it's about ovarian cancer. A case report of advanced ovarian cancer detected due to an inguinal metastasis in the canal of Nuck. Actually, it's a very common diagnosis, like gynecology. Lately, I have two friends who have had pain, pelvic pain, and even myself, I've had pelvic pain. My two friends have pelvic pain for a long time, and they cannot really, first they think, they thought it was appendicitis, endometriosis, pelvic inflammatory disease. And one of my friends had this pain for a year, and they were saying, no, it's nothing. And then recently she had surgery and they took everything out, and she doesn't have any children. They took out only one ovary, but we think that this was coming up from like a year ago. And I've been having also some, I think some of my students, I told them that I had like 6 months of pain and I thought it was appendicitis, but I'm still here, so it's not appendicitis, but it comes and goes. I thought it was a hernia, and this is a little kind of similar, this case report. I mean, it's pain around that area. So, I mean, not ovarian cancer, no, but it talks about hernia also. So maybe it gets a lot of confusing. My friend, the same as me, I thought it was because I have that kind of problem of colitis. Entonces, la parte ginecológica, gastrointestinal, también cuando me duele la espalda, entonces yo decía es muscular del gimnasio, una hernia, colitis o apendicitis, ¿no? So, I have two friends with the same kind of clinical symptoms and me, and I hope it's not something bad.
No.
But my friend, the one in Florida, she had a hysteroscopy done. A ella le hicieron hysteroscopía, and it was cervical polyps. It was polyps, and she also has endometriosis. And the other one was in a really bad endometriosis, and it had like inflamed, pero bueno, le hicieron una biopsia, ¿no? It had gotten the ovary very swollen. So the ovary was like about to rupture, and I don't know, no, creo que sí se había roto el ovario, but it was like a plastrón, a phlegmon, you know, como el apéndice, ¿no? So it was kind of saving herself that way. Y había mucha adherencia, so it looks like this was for a while. Eso también, como yo he tenido cirugías, yo digo que puede ser adherencias y la colitis y todo, una mezcla ahí, pero no he tenido como mi amiga se desmayó del dolor una vez, pues no, pero como a mí me viene y me va y es medio leve, no le he hecho mucho caso. So let's see, this is relatively, well, this was December 2019. And this canal of Nuck, I had never really heard. No, nunca me habían mencionado ese canal of Nuck. Me parece que es algo embrionario. So in some women, it will persist. No se cierra. So you may form a hernia. And we're going to see what happens in this case. The girl had metastases in that area. Ovarian cancer is one of the common gynecologic cancers in women, and it says the mortality rate has decreased, right? Decreased or declined, but it is one of the gynecological malignancies that causes the most deaths. There are relatively lack of symptoms. That's not really good, right? Because when you already have symptoms, it's advanced. You won't see any symptoms in the early stages. Approximately, me asusta cuando hago casos así, ¿saben? Voy a hacer cosas de hombres nomás la próxima vez. Sí, para asustar a los alumnos. No, pero ellos no se van a asustar because they're young, but all these things, I'm like 42, so I get scared. Cuando uno es joven no piensa, yo todavía está muy lejos para estas cosas. So approximately half of all the cases are already advanced in stage 3 or 4, you see, half. The majority of current research is focused on the mechanism of ovarian cancer metastases and dissemination to facilitate early detection of this disease. And in this report, we have an advanced case of ovarian cancer with metastasis to a rare site. That's the canal, ¿no? ¿Algunos de ustedes habían escuchado ese canal? La Tamara, no, yo tampoco. Alejandra, Adriani, never in my life, not even in the United States, que me preguntan cosas que nunca en mi vida había visto. So we have included a discussion of the ovarian cancer metastasis mechanism, Give me 1 second. All right, so we have the presentation of the case. If someone can volunteer to read, who would like to read? Todos van a leer un poquito, Pilar. Okay, Lau, you want to start?
Okay. I'm gonna do it, but I need to say sorry because, you know, I'm here for that reason. I can read well.
Oh, no, don't worry. Don't worry.
I need to read the presentation of case or what?
Yes, this part.
Okay. The patient was a 43-year-old woman. G2P1, one spontaneous abortion, one vaginal delivery with a body mass index of 17.5 kilograms.
Per? It's a per or por, no? Por.
Yes, per square meter. I don't know. Yeah.
Sí.
A square meter. Yeah. She was examined 1 year earlier by a gynecologist who detected her uterine myoma. No ovarian mass was observed. In 2016, she noticed a right inguinal mass without any spontaneous pain. She had her gynecologist check up again. Then she was found to still have multiple uterine, I don't know. Yes, uterine myomas. Myomas?
Myomas. Acá lo dijiste ya muy bien, Pilar. Ajá. Uterine myomas. Igual. Ajá.
Although ultrasound examination revealed an internally heterogeneous cyst, measuring 32 millimeters in size in the right inguinal region, as well as internally heterogeneous cystic tumor of the left ovarian measuring 60 millimeters in size. Then she checked blood tests for tumor marker, carbohydrate antigen, CA, 125.
Only the names, CA and CE,
yeah.
Right? Or carcinoembryonic antigen.
Yeah.
You see, you did very good. Perfect. Just like the rest, right?
Next, please.
Very good. So now let's try to, let's highlight the important stuff. Here we have the clinical history, right? So the age, right, is very important. We're going to highlight 43-year-old women. It's a gynecology, so we have to know how many pregnancies and all this. So she's been pregnant twice, and she had one baby, vaginal delivery, no? Or normal birth, one abortion. Por eso no dice P2, ¿no? Porque uno fue aborto. And one vaginal delivery. Body mass index 17.5, so she's good. Her body mass, bueno, está un poquito bajo, ¿no? Me parece. No, es de 16, está normal. She was examined 1 year earlier by a gynecologist who detected si tenía un mioma uterino hace un año. No, o sea, un año es poco, ¿no? Uno piensa que en un año no va a crecer una metástasis ni nada de eso. No. También una vez vi en Facebook y una chica que estaba así con muchos años y no le habían detectado y era cáncer de ovario también. No ovarian mass was observed. Esto es en el útero, que es totalmente otro lado, ¿no? In 2016, she noticed a right inguinal mass, una masa inguinal del lado derecho, and then she had ahora son múltiples, dice, and she also had a cyst, 32 millimeters in size in the right inguinal region. En el lado derecho, ¿no? Y también otro, ¿dónde? Solo only one or how many cysts?
Internally, internal. He has on the left ovary.
Another one, but in the ovary, right? On the left ovary, measuring 60 millimeters in millimeters in size. Right inguinal region, 32, and cystic tumor of the left ovary, 60 millimeters. And they did tumor markers. Esto es lo que, no, es bacteria lo que hace, ¿no? CA 125, 139. CA, we don't know the normal values, but
I don't remember that. Yeah.
Ah?
I don't remember that. Yes, I was trying to see if it's normal, but
I know. Nobody will remember, I think. El PSA nomás me sé que es hasta 4. So obviously this will be elevated.
Yeah.
Yes, and then Lau can read the next paragraph. So we have that she has myomas in the uterus, and she has 2 masses on the right inguinal region, smaller cyst, and in the left ovary, a little bigger, 60 millimeters in size, with elevated tumor markers. It doesn't say anything about like pain, no? No menciona dolor, it's just maybe she went for the myomas. And then when she was checked, bueno, aquí dice que sí notó, ¿no? Notó la masita, ajá, pero no, without any spontaneous pain, no pain. All right, Lau can do the next paragraph.
Okay. Her menstrual history includes menarche at 12 years of age. She has no reached menopause.
Menopause, yes.
Her menstrual cycle was 28 days. She had dysmenorrhea and menorrhagia.
Yes.
Her medical history was unremarkable
Unremarkable otherwise.
Remarkable otherwise. She has no surgical history, allergies, or oral medications, or history of alcohol consumption or smoking.
Consumption.
Her family history was unremarkable. Her cervical cytology results were negative every year. Okay. So no
history.
No
only pathologies related, but no other personal history.
No medical history and no like risk factors like alcohol, drugs, any of that. And the pap smear, negative.
Yes. Mm-hmm.
These are the CT scan, MRI scans. We can see the mass. Dios mío, que alguien toca. Hold on. All right, sorry. So in the MRI, 2 weeks after presentation, revealed a potentially malignant tumor of the left ovary, complicated by an endometrial cyst. So this maybe endometrial cyst, I guess, it wasn't a uterine myoma, right? Maybe it was the endometrial cyst. The cyst in the right inguinal region was a hydrocele of the canal of Nuck. So the cyst was a hydrocele of the canal of Nuck. We don't know what is the canal of Nuck, but then they will tell us soon. The patient was referred to the hospital for further examination, and then they did endometrial cytology, and the result was negative. The CBC and blood biochemistry were performed and everything. This is very important, right? Also, the labs, everything was normal. So you see, no real like symptoms, right? No pain. It's very scary, right? It doesn't say bleeding also, like uterine myoma and no bleeding, endometrial cyst and no pain, 2 masses and no pain, and lab completely normal. And this person has advanced cancer. So that's why we should always get checked. But here I am also, and we don't really do it, right? But, and the pap smear also, I think it says was normal, right? The cytology over here in the previous, somebody was, yeah, the pap smear was negative every year. No family history also, that's important, and no medical history. No real like risk factors, and she is young, 43. Oh my God, it's my age. The door was delivery for my son. ¿Me escuchan?
Yes.
And this person opened the door and he came in. Because nobody was answering this, because I was having the class and I was trying to, but I said in a moment, hold on. And I was trying to tell my son to come down and he opened the door.
No.
Because I think he could see me from the door because it's glass, and maybe he's like, oh, she's there and she doesn't open. Qué atrevido, ¿no?
Yeah.
Anyways, let's continue. So, imagínense, sí, por eso es que esa gente a veces roba también. CT from the neck to the legs revealed no evidence of distant extra-abdominal spread. Gastrointestinal endoscopy was performed as part of a whole body screening exam, which revealed no abnormalities. So they were trying to see if there was metastasis, right? I mean, they don't really know yet. This is cancer. Ah, no, pero aquí, ay, no, se me marcó todo. ¿Qué pasó? No, aquí dice, contrast enhanced, the MRI revealed a potentially malignant tumor, es que no lo marqué, of the left ovary, complicated by an endometrial cyst. Ahí ya en el MRI les dio características de posible maligno, el tumor del lado izquierdo, ¿no? Y del lado derecho sí era un quiste, ¿no? Que lo que dice acá es que no era un quiste, sino que era un hidrocele de este canal, que es un remanente embrionario.
Inguinal.
Ajá. Entonces, siempre que tenemos cáncer hay que hacer el estadiaje, ¿no? Ver si hay metástasis. So they did a CT scan of the whole, like they do brain, they do, bueno, dice de neck para abajo, ¿no? Pero también se hace en el cerebro, porque puede haber, no es muy común, pero bueno, puede haber, ¿no? The chest, abdominal, to see if there is any metastasis. Endoscopy revealed no abnormalities. The preoperative diagnosis was a left ovarian tumor, a right inguinal tumor, and multiple uterine myomas. The left ovarian tumor appeared to be a borderline malignant or benign tumor. Preoperative diagnosis. Antes de operar, ¿no? So a tumor in the left side, left ovary, right inguinal tumor, and multiple uterine myomas. Por todos lados la señora, ¿no? Surgical procedure. Who else wants to read? Someone else? A volunteer? El caballero que está ahí aquí entre tantas, bendito entre las mujeres, Washington Osorio. Would you like to read? No sé si es doctor Osorio o alumno. Washington?
Hola.
Hello. You want to read this next paragraph?
Surgical procedure.
Surgical procedure. Yes.
We perform an open total
Hysterectomy. Of course, espera un ratito. Of course, this has to be open, right? No vamos a ir con laparoscopy, ¿no? No va a ser laparoscopía ni hysteroscopía because there are two tumors and and it looks like it's malignant on the MRI, so of course they have to open. So the best option is to do an open total hysterectomy. I mean an open surgery. And what they're going to do is a hysterectomy. What else? Washington?
Bilateral annexectomy, or resection of the inguinal tumor and the disseminated tumors.
Yes, disseminated. So they have to they have to take
right. Resección del tumor inguinal
¿Sí me oye? ¿O se corta?
Muy poco. Se corta.
Me avisan si se sigue cortando, ¿ya? So open, they have to remove hysterectomy, the uterus, they remove the 2 ovaries and the right inguinal tumor. Then, ¿se cortó? ¿Ahí que hablé? ¿Se corta todavía? Hello?
Yo quiero. No, teacher.
No. Okay. So, and they found 50 ml of acidic fluid within the peritoneal cavity, which we submitted for rapid cytological diagnosis. Fluido acítico, ¿no? 50 ml en la cavidad peritoneal de estos tumores que a veces segregan, ¿no? O el quiste endometrial que había también. Y se envió para un diagnóstico citológico. The left ovarian tumor was surrounded by adhesions. At dissection, the cystic tumor ruptured, and we aspirated the cystic fluid, debulked the tumor, performed resection, and submitted them for rapid histological diagnosis. Esas son las complicaciones que puede haber alguna cirugía, ¿no? Dice que cuando extirparon el tumor izquierdo o en el ovario izquierdo. Bueno, sacaron los 2 ovarios, ¿no? Porque acá dice en anexectomía, sacaron los 2 anexos y los 2 ovarios, ¿no? Y dice que el tumor del lado izquierdo del ovario estaba rodeado de adherencias. Cuando estaban disecando estas adherencias, el tumor se rompió. Aspiraron ese fluido, liberaron debulk, es como eliminar o disecar el tumor, ¿no? Performed resection, lo retiraron y lo enviaron para patología, ¿no? Encontró nódulos diseminados. Disseminated nodules were observed on the serous membrane surface of the right ovary and surrounding the right tubal fimbria. And so había muchos tumorcitos, como decía acá abajo, ¿no? And they also observed disseminated tumors in the pouch of Douglas, saco de fondo de Douglas, en el ovario derecho y en la fimbria o en la trompa, en la fimbria tubal derecha. Trataron de sacar la mayoría posibles de tumores, ¿no? During the hysterectomy, in cooperation with the gastroenterologist, we resected the cystic right inguinal tumor that was continuous with the right round ligament of the uterus. Entonces, este quiste inguinal derecho, en cooperación conjuntamente, dice, con el gastroenterólogo, porque obviamente esa es la parte de gastro, del inguinal, ¿no? Del colon, entonces se continuaba con el ligamento derecho del útero. También sacaron tumores diseminados de la superficie del recto, and they made sure that they were not obvious macroscopic tumors within the peritoneal cavity. No lymph node was palpable. We did not observe a right inguinal hernia or enlargement of the right internal inguinal ring, so we did not perform additional repair. And due to the results of intraoperative pathologic diagnosis, we added omentectomy. Entonces, durante la cirugía, no soy patóloga, pero creo que hacen una especie de determinación rápida, ¿no? Como con tinciones, porque obviamente no pueden hacer el corte y ver en el microscopio y todo eso que detalla una biopsia, ¿no? Pero a veces, tengo entendido que pueden hacer una determinación rápida por una tinción o algo, y aquí dice que el diagnóstico patológico intraoperativo, ¿no? Por la apariencia física también, obviamente, hay anatomía patológica macro y micro. Si ustedes vieron, ¿no? Macro, vemos el órgano y tiene signos de cáncer que nos determina antes de ir al microscopio también. Y encontrando varios tumores y varios han sacado como 3, 4, ¿no? En el recto, en la trompa, que no sé qué. Entonces, es como obvio el diagnóstico. Entonces hicieron también omentectomía, que es la resección de este layer, ¿no? El omentum, que es lo que recubre los ovarios. Entonces, pathological y algunos órganos abdominales. Pathological diagnosis. ¿Alguien más que va a leer? ¿Quién va a leer ahora? Gracias, doctor Washington. Adriani, estás 2 veces, ¿no? Valeria, ¿puedes leer?
Yes.
Okay, hello. You can read this pathological diagnosis. What results did we have from the pathology?
Pathological diagnosis. Acid fluid cytology was positive, revealing nuclear anisocytosis and cellular aggregates with abundant chromatic. Hay muchas palabras diferentes para mí aquí.
Chromatin, I know, it's very technical, anisocitosis nuclear y agregados celulares con abundante cromatina, ¿no? So those are like abnormal cells.
The intraoperative pathological diagnosis result for the left ovarian tumor revealed serous adenocarcinoma. The right inguinal tumor was also serous adenocarcinoma.
So serous adenocarcinoma. Very aggressive, right? Intraoperative pathological diagnosis. Intraoperativo. So, seguramente en otros países tienen esa capacidad de hacer ese diagnóstico patológico. STAT, ¿no? No tengo conocimiento de que se haga. Yo creo que no en nuestros países latinoamericanos. I don't know if you guys know. Maybe someone that is a doctor already or a surgeon. Ok, porque yo asumo que era por la apariencia, el macro, pero ahí sí dice que patología. Bueno, no dice histo, la verdad. Puede ser referirse a lo mismo, de patológico. Sí, pues al macro, ¿no? So here we have the images. You see these. Let's look at the description. Right upper image of the entire specimen. Left anexa. The left ovary. Es acá, ¿no? En esta imagen. El ovario izquierdo. Se ve bien grande, ¿no? And look at the characteristics. That's not like normal tissue, right? Right at nexa, disseminated tumors measuring 1 centimeter in size, scattered disseminated tumors on the right side ovary. Over here. ¿Dónde están los tumorcitos diseminados? ¿Quién es cirujano? ¿Algún cirujano? Tumor in the right inguinal area. Inguinal region, cystic lesion contained serous fluid, and we submitted the solid components for rapid diagnosis. Tenía un contenido seroso, ¿no? ¿Y las otras imágenes? A ver si. Y acá está la B. This was the right ovary. ¿Qué más? Disseminated tumors. Uno pone las flechitas en esto. Puede ser uno, este otro, ¿no? Disseminated tumors measuring 1 centimeter. Ajá, bien chiquitos, ¿no? In the fimbria, in the tubal fimbria. The scattered disseminated tumors measuring 2 to 3 millimeters in size and the surface of the right ovary. Interesting. And over here is the right inguinal region, intraoperative findings. In the left side, the external abdominal oblique muscle aponeurosis. Bueno, esta es la descripción del procedimiento, ¿no? Open the inguinal canal. Por la hernia, ¿verdad? Del lado derecho, right inguinal hernia. Encontraron una masa quística del lado derecho, hacia la derecha de la sínfisis pubiana. The cyst was adherent to the round ligament and communicated with the internal inguinal ring. Ahí es que dice, ¿no? El quiste estaba adherido al ligamento redondo y se comunicaba con el anillo interno inguinal, de tal manera semejando un hidrocele del canal de Nuck. Disecamos el tejido circundante y realizamos ligadura y transección a la altura del tejido adiposo preperitoneal. Y extirpamos el quiste sin romperlo y lo enviamos a diagnóstico rápido, dice ahí. And on the right, ya cerraron acá con grapas, the inguinal canal and the round ligaments from both sides of the abdominal cavity were removed. The internal inguinal ring was not dilated and no fragility of the posterior wall was noted, and this is the pathology. Tenemos ahí las capas, el epitelio, el ovario, el 1, a ver el A, ¿qué dice? Left ovarian tumor cells with highly atypical nuclei and prominent nucleoli. Vamos a ver cambios celulares, ¿no? Dice núcleos atípicos y nucleolos prominentes. Y las células tumorales proliferaban en un patrón papilar. Right inguinal tumor. En el lado derecho, el ovario derecho. Atipia nuclear, similar a la masa del ovario izquierdo. Y algunas tenían formación glandular. Hicieron las tinciones. Left ovarian tumor, ER, weekly positive, era positivo para este WT, P53. Y bueno, que ayudan a determinar malignidad. Hematoxicilina eosina staining revealed tumor cells with highly atypical nuclei and prominent nucleoli on the left ovaries. Eso es lo que ya leímos. Y aquí están las tinciones tinciones, P53, 100%, ER positivo, diagnóstico terrible, stage 3, ovarian carcinoma, right? Ay, serous, decía ceroso, ¿no? A ver, otra persona que quiera leer. Post-operative. Ya lo operaron, le sacaron, le hicieron el diagnóstico de cáncer avanzado. Entonces, ¿qué debemos de hacer ahora? ¿Cuál es el siguiente paso con este paciente que tiene cáncer avanzado? ¿Hay curación?
No.
No, right? So, in other cases, we will do the surgery, we remove the ovary, and that way we got rid of the tumor maybe, right? But in this case, no, because it's already metastasized. And han sacado todo, pero igual, ¿no? ¿Y qué hay que hacer entonces?
Cuidados paliativos.
O sea, también siempre después de una cirugía dan quimio, ¿verdad? Para atacar un poquito los tejidos, los remanentes tumorales que queden por ahí. A ver, who will read now? ¿Quién quiere leer?
Postoperative.
A ver, post-operative.
Postoperative clinical course. The patient was discharged for the hospital 9 days after surgery. 28 days after the surgery, she received 6 courses of the this regimen, como terapia citostática debe ser.
Ajá.
Ese régimen, Paclitaxel, carboplatin, every 3 weeks as well as bevacizumab. The patient has not relapsed for 2 years.
Has not relapsed for 2 years. I mean, what specialty are you, Dr. Osorio? Osorio, ¿verdad?
See, I am nephrology.
Oh, okay, good. Nice. So in this case, I'm a little confused because they're saying stage 3, and they were saying, I mean, there's no distant metastasis, ¿verdad? Because we didn't really have other organs outside of the uterus, right? But so what do you think? You there are, and they're given, no, there's no relapse. I thought it was like very advanced and ¿qué opina, doctor?
Le fue bien, ¿no? No tuvo recaídas.
Sí, me parece, ajá, por eso me sorprende, ¿no? Porque
Sí, recibió quimioterapia con ¿cómo es? ¿Qué dice?
sí, pero no,
Se
no
fue.
mencionaron si removieron nódulos, ¿no? Si tenía algún, porque se había metástasis a los nódulos linfáticos.
Ujú. Pero le fue bien, ¿no?
Ajá.
Recibió terapia citostática,
Pero para estadio 3, ¿dónde está mi celular? Veamos, estadio 3. Entonces no hay metástasis distales.
Me imagino que por eso lo reportan, ¿no?
Ajá. cancer has spread outside of the pelvis to the lining of your abdominal cavity. It can also spread to the lymph nodes in the back of your abdomen. ¿Cuál es la expectativa de vida? Dice 5 years, 41%. En 5 años, 41%. Bueno, dice que sí puede haber curación en estadio 3. Mantener en remisión. Yo pensaría que 3, 4 ya es muy mal pronóstico, ¿no? Bueno, discussion. A ver, un poquito más, doctor. Lea hasta aquí, hasta ahí donde dice figura 5.
Discussion. We encontré a case of ovarian serious carcinoma, believe it to be a metastasis to the right canal of Nuck. The canal of Nuck is a portion of the processus vaginal that lives within the inguinal canal in women, and is presence indicated patient's process vaginalis.
Ajá, yeah. So aquí explica qué es el canal. ¿Usted había escuchado eso? Ya que es nefro y anda por ahí. No, canal de Nuck.
No.
No, nadie. Que cuando hice la pregunta habían menos informados, nadie. Todos somos médicos, estudiantes, no. Y eso. Tal vez nos lo dieron en embrio en algún momento, pero dice que el canal de Nuck es la porción del proceso vaginal que se encuentra entre el canal inguinal, se encuentra dentro del canal inguinal en las mujeres y su presencia indica un proceso vaginal patente. O sea, embriológicamente asumo que debe haberse cerrado pues este canal, ¿no? Que está dentro del proceso vaginales y no se cierra. Y puede formar un hidrocele. Hay un hidrocele del canal de Nuck. Ahí explica por qué se forma porque puede estar el canal de Nuck ahí y no pasa nada, ¿no? Y uno ni sabe, ¿no? Pero dice que se puede formar en hidrocele como una complicación. Vamos a ver de qué. A hydrocele in the canal of Nuck is thought to occur due to cyst formation in the remnant patent processes vaginalis. Since the canal normally closes after birth, normalmente se cierra este canal luego del parto. Pocos reportes de hidrocele en el canal de Nuck en los adultos se encuentran disponibles. Sin embargo, dice que se puede formar esta formación quística en los procedimientos quirúrgicos, dice, porque siempre saben que cuando van a operar insuflan aire, gas, ¿no? En el abdomen para producir neumoperitoneo, ¿no? Para poder operar y que las vísceras no colapsen, me parece, ¿verdad, doctor? Nefro, porque tal vez hace cirugía o es clínico.
Clínico.
Ya, bueno, pero a mí sabemos que introducen gas también, ¿no? Para, se insufla el abdomen. Entonces,
CO2.
ajá, eso, CO2. Debido a la prevalencia, el uso de la cirugía laparoscópica, algunos casos, reportes de casos describen hidroceles latentes en el canal de Nuck luego de la insuflación intraperitoneal. O sea, es una complicación porque insuflan demasiado aire, ¿no? O a mucha presión, dice. Incluso a presiones inferiores a 10 milímetros, a 10 de mercurio, dice. Estos hidroceles deben considerarse una complicación del aumento o de una presión intraperitoneal elevada. The relationship, esa es una causa por la que se puede formar, ¿no? Otra razón, the relation between endometriosis and hydroceles in the canal of Nuck is interesting. Some Nuck hydrocele cases associated with endometriosis have been reported. Notably, the tumor is sometimes closed and has no communication with the abdominal cavity. Pero, a ver, se me fue algo ahí. La relación entre endometriosis y hidroceles en el canal de Nuck es interesante. Algunos casos de hidroceles Nuck se han reportado algunos casos asociados con endometriosis. Notablemente, el tumor algunas veces está cerrado y no tiene comunicación con la cavidad abdominal. En algunos, o sea, el del canal, ¿no? Ajá. En algunos casos se han reportado casos de embarazo ectópico que ocurrieron en el canal de Nuck, en un paciente con un anillo inguinal cerrado debido a la presión de una lesión endometrial. Este caso sugiere que algunas células intraperitoneales migran hacia el canal de Nuck cuando la presión intraabdominal está aumentada o por endometriosis, aún en presencia de un anillo inguinal patente. A ver, even if the presence of a patent inguinal ring cannot be clearly confirmed during surgery. Ya, incluso si no se puede confirmar la presencia de este anillo. Y entonces buscaron en la base de datos cáncer, reporte de casos de cáncer con hidrocele en el canal de Nuck y solo encontraron 4 casos. O sea, es bien raro, ¿no? 4 casos de los que uno era o sea, 3 nomás. Esto también es raro, ¿no? Dice que la mayoría eran del lado derecho. All reported cases were on the right side. Both cancerous lesions and endometriosis were observed in a total of 3 cases, including our case. Our case was also the only case in which the tumor in the inguinal region was a metastasis of ovarian cancer. Accordingly, the uterine endometrial a ver, entonces, acá en cambio en otro estudio no encontraron endometriosis, ¿no? Porque el otro estaba diciendo que hay una relación entre la endometriosis y el ciste del canal de Nuck o hidrocele, ¿no? Acá no encontraron esa relación y no communication was noted between the peritoneal cavity and the hydrocele of the canal. Bueno, y tampoco es bien raro, y dice que no se puede especular que el endometrio uterino haya sido trasplantado en el canal de Nuck y proliferado. Más bien lo que consideran es que el peritoneo del proceso vaginalis sufrió epitelización. Es todo un... Y por eso había tejido uterino, o sea, endometrial en el canal de Nuck, lo cual resultó... y acá también tiene carcinoma endometrial. En ese caso, pues no, resultó ser carcinoma endometrial. Asumimos que el mecanismo de metástasis a un hidrocele en el canal de Nuck, lo cual es considerado como una cavidad cerrada, es el resultado de la diseminación basada en evaluaciones citológicas e histológicas en el presente caso. Bueno, y que hay que investigar el proceso de instauración de una endometriosis ectópica y embarazo ectópico, lo cual nos puede dar nuevos detalles o nueva información sobre la evaluación de la diseminación del cáncer de ovario. Investigating the process of the onset of ectopic endometriosis and ectopic pregnancy may provide new... O sea, como el proceso por el cual como decimos, se aloja ese tejido endometrial en una parte que no debe ir, ¿no? O el embarazo ectópico puede ser también una clave para conocer el mecanismo por el cual se disemina el cáncer de ovario, porque hay esos implantes también, ¿no? Distantes entre comillas, porque igual estamos en el área ginecológica, pero me refiero a lejos del área, como en este caso el ovario, ¿no? Conclusion. Who wants to read the conclusion? Alejandra?
Yes, teacher.
Okay.
We encounter an advanced case of ovarian cancer with metastasis to an inguinal cyst that arose in the canal of Nuck, which is a rare site for metastasis to occur. Further studies are required to further clarify the mechanisms of ovarian cancer metastasis to the canal of Nuck.
Porque recuerden que, ¿a dónde estaba el canal de Nuck? On which side?
Right side.
In the tumor?
In the tumor.
I mean, the ovarian tumor. El tumor de ovario, ¿dónde era? ¿De qué ovario?
Left.
On the left side. So it's usually it will disseminate to the areas around, right? First is like local dissemination. Así se propaga el cáncer, ¿no? Primero a las áreas circundantes, but not like on the opposite side, on the other ovary. So, I mean, close to the ovary. So that's why they're saying that because there was this remanent tissue, este tejido remanente, que no se sabe, ¿no? El mecanismo como tal, cómo se diseminó hasta allá, ¿no? Y lo que ellos creen es, como les digo, que había sufrido epitelización, ese proceso vaginales. Que era peritoneo, sí, tejido peritoneal, pero que se epitelializó, se podría decir, se convirtió en epitelio, ¿no? No, en ese caso de ese otro paciente, ¿no? Pero en este caso era igual del ovario. Entonces leamos el resumen ahora del abstracto. Alejandra, un poquito más. Alejandra estaba leyendo, ¿no? Introduction. You can read introduction.
Introduction. Ovarian cancer has few subjective symptoms, so approximately 40% to 50% of cases have already reached stage 3 or 4 by the time of diagnosis. These are advanced stage of the disease and have poor prognosis. Among these cases, less than 3% are reported to exhibit inguinal lymph node metastasis. This report documents a rare case of advanced ovarian cancer that we detect due to an inguinal metastasis in the canal of Nuck. The work has been reported in the line with the criteria.
Less than 3% are reported to exhibit inguinal lymph node metastases. So this, they're saying, they said there were only 4 cases, right? And this was 4 with this one. So in the whole database, they only found 3. And this was the 4th case. So it's a very rare case with metastases. First of all, de tener en canal de Nuck is weird, right? It's not very common. And then to have a metastasis there is, again, a rare case. And the presentation of the case.
The patient was a 43.
No, espérate, someone else. Thank you anyways. Maybe Alexandra.
Sure. Okay. Presentation of case. The patient was a 43-year-old married premenopausal woman, G2P1. She was examined by her local practitioner for chief complaint of a mass in the right inguinal region and was found to have an right inguinal mass. Magnetic resonance imaging MRI scans revealed a left ovarian tumor, and she was referred to our department. Rapid intraoperative diagnosis showed a highly atypic serous carcinoma present in both the left ovary and the right inguinal region mass, when the tumor had extended into the canal of Nuck.
Highly atypical serous carcinoma present in both the left ovary and the right inguinal region mass. Está en las dos lados, pero uno era el ovario y el otro era la masa inguinal. ¿No? Discussion, Tamara.
This
Yes, you can read
discussion.
discussion.
In the case the right inguinal mass was ovarian cancer that had metastases to assist in inguinal hydroceles, sometimes undergo fine needle aspiration.
¿Dónde estás?
Ya
No
terminé.
dijiste la primera oración, pero no dijiste la primera, ¿te saltaste?
Yeah.
Repito.
Sí. Me hiciste
Ahí está.
trampa. A ver.
In the case, the right inguinal mass was ovarian cancer that had metastases to assist in the canal of Nuck via the wrong ligament of the uterus. Though many adult women with these types of inguinal hydroceles sometimes undergo fine needle aspiration.
Ok. La masa, thank you. La masa inguinal derecha era cáncer ovárico que había hecho metástasis a un quiste en el canal de Nuck. O sea, sí, aparte había una masa inguinal, ajá, y lo del canal, en el canal de Nuck es un quiste. To assist in the canal of Nuck via the round ligament of the uterus. Y alguna de estas mujeres dice que lo que se les hace es aspiración con aguja fina, ¿no? De hidroceles inguinales, que es bien raro porque obviamente el hidrocele no ocurre mucho en mujeres, pero en este caso, right inguinal mass, because what they saw in the MRI, right? Porque los que vieron en la resonancia magnética le decidieron operar, ¿no? Al ver que había esta gran masa también en el lado izquierdo. This finding may highlight the need for a careful search for metastases to the inguinal region in cases of ovarian cancer. Esto nos hace, nos destaca la importancia de hacer un estudio cuidadoso para investigar metástasis en la región inguinal, dice, en el caso de las mujeres con cáncer de ovario. Bueno, entonces, that's all for today. If now we all know what is the canal of Nuck. And we still have to go and look it up and see what is the canal of Nuck. Case of advanced carrier. And now we know that stage 3, I always thought stage 3 sounds like, wow, all right, like almost 4. But in this case, apparently it was a big surgery and she had everything removed. So with the chemotherapy, apparently looks good, right? And the best thing in cancer, what is the best conclusion that we can have from this, like a way of preventive measure? What would you say that women should do?
Check
Yes.
her inguinal part.
Good, Pilar, very good. I had a friend tell me once because his wife died a year ago, actually. It was recently a year ago. And she was my age also. And she had cholangiocarcinoma. gallbladder, right? Gallbladder, vesicula.
Mhm.
And she started having symptoms and she died in 2 months. She never had symptoms before. And it was already advanced stage. And he told me, because I told him I was having this pain and that I was a little scared. And he told me we should all get a CT scan every year. Abdominal, most. No, because abdominal is very, and lately I have seen that it has increased a lot, like GI pathology, liver, gallbladder. I know a couple of people, and colon also. And that's all because of the food we eat also, right? So, and the stress. Remember, stress is not only to be worried and anxious all the time. Stress is any harm to your body, like not sleeping well, drinking alcohol, smoking, no, all that is stressful or toxic to your body besides all the processed food and all that. So you guys are young, and that's my advice to you, that I'm twice your age. Sleep. I always tell my students, sleep well. That's the best thing that you can do to your body, and exercise and relax in life. Take it easy. I know at my age, maybe you can say take it easy, but when we are studying in medical school, we don't realize everything, right? And we don't even eat well. And then we have gastritis and we have everything. Okay, but anyways, I'll let you go. I'll see you next week. And Pilar, if you have anything, you can text me. Por ahí, bueno, no sé de qué grupo es, pero si tiene alguna pregunta, en algún grupo tal vez, porque no es de mis grupos, entonces no sé si puede conseguir mi teléfono, pero si tienes alguna pregunta, alguna cosa de allá, ¿no? Porque yo hice eso y no es difícil, es fácil. Solo es perseverancia. Disciplina, orden.
Sí.
Es lo más importante. ¿Tienes hijos?
Sí, uno de 12 años.
Ah, ya está grande. Es más fácil así, ajá. No,
Sí.
pero igual.
Ay, eso. Trabajar en equipo.
Sí.
Afortunadamente sirve, sí. Estoy tratando de hacerlo y sé que lo voy a lograr.
No, sí. Aquí vamos a todos apoyar. Suerte, Pilar. Entonces nos vemos en la próxima clase. A todos, chao, chicos.
Chao.
Thank you. Bye bye. Have a good weekend. Have a good weekend. Bye.
Bye, teacher.
Perdón por la cámara. Bye.